Hello everyone, Janelle Tennyson here with the Joint Replacement Academy. I want to talk to you today about routine antibiotics prior to dental cleanings after joint replacement surgery. There's been a very long tradition of surgeons requiring patients to have a dose of antibiotics prior to routine dental cleanings for the rest of their life after a joint replacement surgery. The rationale for it is this: all of our mouths have a great deal of bacteria in them. Even someone that has very good oral health, there is invariably some bleeding that happens when routine cleanings are done. So the fear was that in the presence of multitudes of bacteria, theoretically, some of that bacteria could enter the bloodstream and find its way to that prosthetic joint and put it at risk for an infection. So in 2016, the AAOS, or the American Association of Orthodontic Surgeons, and the American Dental Association reversed their recommendation about taking antibiotics before routine dental cleanings. They feel that recent research has shown that the risk of infection from routine dental cleanings is extremely low. Studies find very little evidence that bacteria from the mouth introduced during dental cleanings actually travel through the bloodstream and cause an infection in the joint. They further go on to say that the potential harm from antibiotic overuse outweighs the benefit for most people. So there are certain high-risk patients that are still advised to take pre-cleaning antibiotics. That would be patients with autoimmune conditions, poorly controlled diabetes, an active cancer diagnosis, somebody that has a history of a joint replacement infection. So those types of patients still would be recommended to take those dental antibiotics. One more thought on the matter is that most surgeons do not want you to have any dental cleanings for about 4 months after surgery. During that time, your body's working really hard to recover and repair from having this major surgery. And while it's working hard to recover, that immune system is probably not as robust as it normally would be. So that's why they want you to avoid having any routine dental work during that period of 4 months after. Now, if you have a dental emergency that comes up, like a sore tooth or a tooth abscess, cracked tooth, I'm pretty sure that your orthopedic surgeon would probably want to have that looked at and treated, rather than letting something just kind of fester in there. So in that case, it would be very important for you to reach out to your orthopedic surgeon and discuss the matter with him. And most likely, you would need to have an antibiotic prior to having that looked at. All of this being said, though, even though the AAOS and the American Dental Association has reversed their opinion on dental antibiotics, there's a decent number of surgeons that still just feel more comfortable having their patients take antibiotics for life prior to dental cleanings. And if that's the case, 100% follow his instructions. He has every right to make that decision. So have a good day, everyone, and we'll talk again soon.